My name is Richard F. Gillum. I live in Silver Spring, Maryland. My earliest connections to the United Methodist Church were back in Kansas City, Kansas, where I grew up. I had a neighbor who was a committed United Methodist, and he invited me to attend his church. So it was called Mason Memorial United Methodist, and I attended there for a number of years before I went off to college. I decided that, early in my career that sort of doing direct patient care was important, but I felt that I could have a bigger impact by doing this preventive work, because you can only see so many patients in a day, but if you could educate the public to change their lifestyles and get early care, that maybe you could have a bigger impact than just the patients you personally could see. Spent some time in the public health service, working at the Department of HHS in the Washington area, and a year of that time was at the National Institutes of Health. So I think that's where I really got interested in the field of epidemiology and heart disease prevention. So then I spent about 10 years or so at the University of Minnesota doing research in heart disease prevention. And then I moved to the Centers for Disease Control and Prevention. And that's where I spent the latter portion of my working career at the National Center for Health Statistics, doing analyses of different surveys that are done there and reporting the results in scientific journals. So when I retired from that, I began working part-time at Howard as an adjunct professor. As we go through higher education, there's inevitably there are going to be questions of faith that are going to arise, particularly when you're in a scientific discipline. And how can you maintain a faith in a supernatural power or world when so much of the scientific community is not attuned to that, or maybe is contradicting that. So I think it's particularly helpful to have people who've sort of been through those questioning periods and still maintain their faith to help guide students as they're kind of trying to answer those same questions for themselves. So I think the Wesley Foundation and the Methodist Church have both been vital to me in trying to deal with those questions, to influence, help young people maintain their faith and not lose it as they go out into the world. Well, that's what I'm trying to do at Howard University and in my local church. Well, I think in the local church, I've tried to be a member of the missions committee in most of the churches where I've belonged. So one area that we've tried to respond to is the homeless, needs of the homeless in our community. So that's been particularly important here in the Silver Spring, both with the two Methodist churches that I've belonged to here, Colesville United Methodist and now Good Hope Union. So we've hosted the homeless in our fellowship areas during the winter months at both of those churches. And I guess I would like people to know that we all have gifts and we all have limitations, and that we should just try to focus on the gifts that we have and live with the limitations, and know that what the Lord asks from us is to use our gifts, and then that He'll help us with our limitations, and that and not to spend a lot of time regretting what you couldn't do, but try to emphasize what you can do and can still do, because I think as long as we're here, whether we're retired or whether we're in full health or partial health, that we still have work to do, and as long as we're able, that we need to follow the example of the Wesley brothers and trying to do as much as we can for as many as we can for as long as we can.